Welcome to Health Matters, a podcast presented by Wellmark Blue Cross and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Karim Amiry. On today's episode, we speak with Cammy Jenkins, Vice President of Health Services, about a top priority for many of our employer groups, employee mental health.
Thank you so much. It's great to be here, and I am super excited to be able to talk today about such an important subject. So look forward to our conversation.
Well, I'm glad you're joining us. So to set the stage for today, I just want to share some statistics that I found that I think many of our listeners will probably find very concerning. The first one is 9 in 10 employees report that their workplace stress affects their mental health. And the second one is behavioral health conditions are rising and that they are projected to contribute to $16 trillion in lost productivity by 2030, making this one of the largest concerns with employers nationwide.
I think some of those statistics, when you hear them and you hear them out loud, just sort of the sort of massive impact. And when you think about, too, we spend such a large chunk of our time at work. And so if we are having productivity issues, if work is stressing us out, if we have issues that are really impacting, and that's where we're spending a good chunk of the day, I can totally see where employers are wondering, how are we going to handle this? What are the things that we can do? How can we be a partner with our employees, especially with some of these statistics? And when I think about, just the future of, how much people are working.
Yep, totally agree. A lot of times we see, in the top conditions, mental health used to be down in, low 10s or outside the top 10. Now it's in the top 5, top 3 sometimes. So, yeah, a very big deal for our employees.
Yeah, absolutely.
Our employers.
Yeah, absolutely. And then also, many people as well have chronic conditions that they're dealing with as well. And then when you add in a behavioral health, mental health condition on top of that, that just really impacts what we're seeing for individuals.
Yeah, so that sparks a question that I know, a lot of people may think about. We hear behavioral health and mental health and sometimes being used interchangeably. Can you help us define or differentiate the difference between the two, or if there isn't a difference?
Yeah, absolutely. I know personally myself, I interchange them all the time. But when I think about and how I see, when people are referencing, we think about mental health as sort of that larger overarching umbrella. And then when underneath there are behavioral health conditions, right? So some of the mental health things can lead to behavioral health sort of conditions, such as, I think about, substance abuse, alcoholism, those sort of things. But there's also things when you just think about maybe daily stress, right? That can lead to maybe some mild depression or anxiety. It doesn't necessarily need to be, those things, if left untreated over time, can certainly, right? If someone are really stressed and you find that maybe gambling helps that, it's probably not, right, the course that you want to go down. But if, kind of peeling back that onion and understanding what are some of those behavioral health things, right, that are going on, focusing in on that, and then being able to help our individuals sort of understand. So it can be used interchangeably. Sometimes behavioral health is a little softer. So you'll hear, behavioral health coaching, you'll hear behavioral health sort of conditions, but really mental health is that overarching sort of umbrella that encompasses really all of those behavioral health conditions underneath.
Yeah, it's interesting you mentioned the wording being a little softer, because I know I've seen, in some articles or other webinars or, talking to others that, the two biggest barriers for seeking care for mental and behavioral health is either access, but also that stigma. So,
Absolutely.
When we address the stigma, traditionally, there's been negative views of it. But what are your thoughts on how employers can help their employees with that?
Yeah, I think one of the biggest things is just having the conversation, being able to talk about it, in the workplace. I know we talk and feel comfortable talking about medical conditions. I think, behavioral health is sort of the same way. So just having, creating a safe space to be able to talk about that. I think employers too, I've seen this just in team meetings, talk about what's causing you stress at work and what are some of the things that, hearing from individuals, right, making it sort of that safe space to have the conversation, but also then doing such things as, lunch and learns. You can do such things about just some of the terminology. We talked about mental health, behavioral health. What does that look like? Doing some lunch and learns. There's also things, mental health first aid is a great sort of tool that you can do with your employees that really helps people understand sort of the differences. How do you talk to someone that maybe is expressing words or, different things, they're stressed or, so I think there's lots of things you can do, but I think first and foremost is just, having it be okay to talk about in the workplace. And then, where are some resources that we can help drive people to.
That's great. I know as a leader myself that I could use some of that help.
Yeah.
So appreciate you talking with me today. Concerning the other issue, that being access, a statistic that I saw is that 80% of rural communities or rural counties do not have a single psychiatrist. Mm-hmm. So can you share your thoughts on how we as Wellmark are addressing some of that issues for our members?
Yeah, and with Wellmark in particular, so much of our membership is rural. So when I think about Iowa and South Dakota, I grew up in a small town, so recognizing sort of that shortage of, just appropriate help for, behavioral health conditions. One of the things that we have here at Wellmark is Doctor on Demand, which is a virtual solution. And what I love about this is that it connects individuals regardless of where that individual is at. So, for instance, a great example to illustrate that, we currently reach out to individuals after they've been hospitalized. In particular, we have for substance abuse, depression, those sort of things. We outreach to someone who needed a follow-up for their appointment. And we know that getting to individuals after they've been discharged is important, and making sure they have the things right, such as a follow-up appointment. Well, if you don't have someone you can go to, the potential for being readmitted is significantly increases. So we were able to get an individual connected with a psychiatrist on Doctor on Demand. They were able to have their follow-up appointment. They just felt really thankful that we were able to connect them, because they were feeling like they didn't have the tools to be successful once that they were discharged, but being able to connect that. So, while access continues to be an issue, being able to provide solutions like Doctor on Demand for our members who are in that rural setting, I think is going to be key to really, ensuring our people have the right, care at the right time.
Yeah, thanks for sharing that, because I know in our conversations with employers that comes up a lot, because sometimes we see that Doctors on Demand isn't always utilized as much as maybe they would hope or we would think, but it's great to hear that your team is also helping getting people connected with them as well. So outside of addressing like access and stigma, can you answer the question we hear often from our employers about what exactly are we doing for members with behavioral health issues?
Yeah.
I know you mentioned one piece, but
yeah,
I'm sure there's a lot more.
Yeah, and as you were talking, I was thinking about, this really ties into the things that we're doing from a, case management standpoint. So being able to work with individuals who are having a whole range of things, right? So people, stress, anxiety, right? Maybe they're a caregiver for someone, so they're experiencing, some stress or depression with that. We have case managers that have behavioral health backgrounds. We have social workers on our team who are able to make that connection. So in that previous example, it was a social worker that reached out. We knew about the resources that we had, and we're able to connect that individual with that Doctor on Demand. So it's really working holistically with individuals on our team, but then also accessing the tools and resources we have, like Doctor on Demand, to be able to connect the dots and navigate. I look at case management, sort of that wrapper around our members, really shepherding them and helping them get the care that they need. And behavioral health is just a great example of where we can help individuals, because unlike medical, it's not as well talked about. And so when people reach out, we want to be able to help and support them and guide them to where they need to go.
Yeah, thanks. And I know in our conversations, I think I've heard you mention that we've recently expanded our specialties around behavioral health in your area. So, this is pretty exciting, and as well as we can serve members better. But can you expand on those new capabilities?
Yeah, absolutely. Dr. Matt Stanley has joined our team. Super excited to have a dedicated medical director just for behavioral health. We are also expanding the capabilities within our case management team. So looking at, are there subspecialties such as eating disorders or substance abuse, chemical dependencies, those sort of things, expanding the clinical expertise on our team to be able to support that. And then also looking at how are we identifying behavioral health? We do a great job of identifying individuals that have medical conditions, but how are we zeroing in on the behavioral health conditions that we can then do outreach to work with their providers? So making that. So super excited to have the combination of expertise with our medical director and then also increasing the clinical acumen on our team as well.
Look forward to working with them in the future.
Absolutely.
It's going to be great. I know we have time for one more question, and probably one that's on minds of our listeners is what can employers do outside of health plan benefits or offerings to help with all this?
Yeah, that's a great question. And I think we talked a little bit about that, earlier, just normalizing behavioral health, talking about that, whether it's on one-on-ones, whether that's in, team meetings, educating leaders and managers on the topic, right? Importance of speaking openly about mental health and their workforce. Also encourage speaking on the topic, starting at employee onboarding and beyond, just sharing, regular reminders, communications, making sure people know resources, things, where they can, direct people to, because I know I hear that from employers too. It's like, I don't know where to direct them to. I don't know what resources, but having those available and being able to help direct is super important.
And when people think about access, especially for them or their dependents, what are some other options that they may have?
One of the most important things I think about just reminding individuals is that if they don't know where to start for themselves or for their kids, is to start with their primary care physician. They certainly can help them sort of navigate, understand sort of what's going on, and then be able to help them get, to other resources that they need.
Cammy, appreciate that, and really appreciate you taking time out of your day to join us and chat about mental health and what Wellmark is doing.
Absolutely. It's been a pleasure. As you can tell, super excited and excited for where we're going with Wellmark, with being able to support our members in this particular area.
Yeah, I think our listeners can look for more things in the future.
Absolutely.
So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.
This podcast is brought to you by Wellmark Blue Cross and Blue Shield of Iowa and South Dakota. Wellmark Blue Cross and Blue Shield is an independent licensee of the Blue Cross and Blue Shield Association. To learn more about Wellmark, visit www.wellmark.com.